We are going to explore various forms of bad habits in lifestyle that can impair your sexual and reproductive health, and using the beginning of year and Chinese New Year to use it as a way to have a New Year resolution to cut down on these bad habits. And one important one is alcohol consumption. So alcohol is well known to cause several things. Number one, its suppressive effect might actually get somebody to have a high risk-taking behavior during sex. However, it also will have a suppressive impact on the erectile tissues. So many men who, when take too much alcohol, may experience a terminology called whiskey dick. What does that mean? In fact, the suppressive effect in the brain will also suppress the blood supply into erectile tissues, and whiskey dick is actually known to have a temporary effect in a short-term impact on sexual health. Secondly, in a more longer consumption of alcohol, the liver function test might be affected and men might undergo problem with cirrhosis. Men with cirrhosis will have a suppressed level of testosterone and elevate level of estrogen. What impact has that on you? It will suppress your libido. So it's well known that men attend alcoholic recovering therapy. Actually, they will improve their sexual function, especially the libido, and men continue to drink alcohol will have a very low libido. But worse still, once the consumptions of alcohol is increased, then the sperm qualities are reducing. The spermatic cells in the testicles are actually not very forgiving for two components, cigarettes and alcohol. The consumption of alcohol can suppress spermatogenesis in all parameters. It reduces the number, the actual motility, and the morphology. So many men who consume too much alcohol will also undergo a condition called testicular atrophy, and subsequently might render them infertile. Next week, we're going to consider how is obesity and also high fat intake affecting your sexual and reproductive health. So if you're interested, stay tuned for next week's Putting Dr. G on the Spot.